Great. Thank you so much, everyone, for joining us today for a special session for this. And also, you probably know I'm actually from a different background. I'm actually in Doha, Qatar right now. So actually, I'm actually here helping them part of some planning for their deployments. And after this, I'll be half on the airport, and hopefully I can actually make it back to San Francisco. So the way we're going to start out with is, I know a lot of you are really busy and you guys are really stressed. I thought we just start out, there's a bunch of really interesting legal issues that really just came out. So I brought on one of our very favorite guests from the past, Charles. He's going to just share us a couple of minutes, just give a really quick update on from the legal side of the things, like what's going on in there. Okay, Charles, maybe you can just start with the just maybe a little bit about yourself for some of the people who might not know you yet. So maybe just share with us what should we know?
Sure, happy to. Charles Dunham, I'm with Greenberg Traurig. I'm a healthcare attorney. By definition, I do everything under the sun: business, transactional, regulatory, reimbursement. My two primary focus areas are clinical labs and telemedicine, telehealth services with providers, any players within those markets. And so it's sort of a perfect storm here on the lab and telemedicine side with the coronavirus and the updates we've seen from the government. Obviously, everyone's come across the CDC announcements, the FDA, FTC, everything on that front. I wanted to give you a little color on what we're seeing as far as it applies to telemedicine services and the waivers or loosening of the regulatory framework that's out there. So I think everyone's familiar with the fact that the Coronavirus Appropriations Act was passed very quickly and signed into law on March 6th. That had a specific section on telehealth services during emergency periods, as this is being defined, and it gave the HHS Secretary over CMS and Medicare the ability to modify or waive the requirements or restrictions on the coverage of telehealth services under the Medicare program. Those being geographic location, modality, originating site, those types of things. So it actually amends the Social Security Act. So it's a pretty significant change. And it shows how quickly the legislature can amend the Social Security Act if they in fact want to. So the geographic... Yeah.
One of the questions we get asked when a lot of physicians, I just want to maybe you can clarify. So for Medicare, before the originating site cannot be a patient's home, does that mean now that a physician, they can bill for a patient if they do a telemedicine call from their home?
Sure. That restriction still is in the Social Security Act under telehealth services. What this new amendment has done is created an exception in the event of an emergency, like when an emergency is defined. So the emergency area now will have to be defined, but the originating site now, yes, can be at home. The Medicare beneficiary can be at home in these circumstances. And the other change is that the modality by which that individual can receive a consultation can now be telephone only. Well, I shouldn't say only. It can be by telephone so long as it has an audio-visual component, which everyone's smartphone has an audio-visual component. Now, again, this is only in the emergency situations like we're presented with. Interestingly enough, the government still hasn't defined the emergency areas, right? Those still don't exist. So it's not yet set into place, nor has CMS released notification that they, in fact, are going to adopt those waivers or make the modification. But it's pretty much a perfunctory step, I think, at this stage, for two reasons. Number one, just within the past few hours, there has CMS released notification to Medicare Advantage plans on the fact that they want to initiate these changes to loosen the restrictions, not only on coverage of testing, but also the modality, the ability to have engage with Medicare beneficiaries via telehealth. So this is going to happen. They need to define the emergency areas, but this is certainly something that's going to happen. One of the weird things, though, Milton, is the restriction on the provider definition still is in place, but there's a restriction that only providers that have in fact engaged with that beneficiary in the past and have been paid for services in the past 3 years, or someone within their practice, are able to take advantage of this emergency waiver. So that's really important to understand when you're saying, hey, can we just, are the floodgates open? No, you necessarily had to have some prior relationship with that beneficiary or someone within your practice group.
Okay.
So the other things that I wanted to point out is that CMS and Medicare does have the authority to do a temporary adjustment in these emergencies, and in fact has done so. They've already released several FAQs about coverage for testing, testing with CDC test kits, testing with FDA-approved testing. They have new HCPCS codes for all of that testing. And CMS is really promoting the telecommunication technology-based services, i.e. virtual check-ins, remote patient monitoring, all of those things that can be done and that don't have any of those restrictions on geographic area and originating site and the like. So they really are encouraging existing relations with providers and providers to reach out and to engage with beneficiaries on that end. One of the things that I mentioned in the beginning was the impact and just basically how quickly the government and Congress can act to remove these Medicare restrictions if they want to. I think this is an example of how quickly they can act. I also think it shows that they have loosened those restrictions in this instance for at-home setting, and it could be a pathway for future changes because it shows how quickly all of those things can happen. And I know you wanted all the listeners to understand some of the what to watch out for and still be careful of.
Yeah.
We highlighted a few of those, right? There's still the restrictions. It has to be an emergency area. It has to be a prior relationship in the billing. They haven't defined those emergency areas yet, but also be cognizant we still have state licensure issues. First few states have emergency waivers on out-of-state providers. Few Medicaid programs have adopted similar. I think that'll probably come in line, but few have emergency waivers on these types of things. California, being a very progressive state, does, but not all of them. Not all of them do. Remote prescriptions, informed consent. There's still those state laws that you have to comply with. You need to still make sure that you're getting the required documentation of informed consent. And we still have for remote prescriptions and actually being able to care for that individual in their at-home setting. DEA still hasn't released their special registrations. You still have the state limitations that you have to respect.
Got it. This is really helpful. Charles, I guess for the audience member, if they want to find out all these more details, is there I know talking to you is of course the number one resource. If they don't get a chance to talk with you, what would you recommend? How would they go find out more than all these latest things?
Honestly, keeping track of it, I'm following the CDC's websites. I'm following CMS, where there's a number of resources out there, not only VSee, but also, all of the other telemedicine associations and trade organizations. They're doing a good job of staying on top of it. There's just a lot of information. We thought healthcare had a lot to throw at us all the time on a daily basis. We've got even more of it now. So those are the resources that I'm following. I'm advising my clients on a regular basis about, testing in the lab world, telemedicine coverage and the expansion and how to respond to that and make sure that they're prepared to provide the service, but also get reimbursed for it down the road.
Okay, excellent. Charles, thank you so much for your really timely advice and insights.
You bet. Appreciate it.
Thanks. For the audience member, we'll share with Charles information later on posted. You can definitely find out. So we're going to switch gears a little bit. So now we're going to share on the more practical aspect of, let's say, specifically what should you do from. So the way it's structured is, I'm going to start focusing on as if you're an individual doctor or therapist, what should you do? Again, I'm going to try to aim for very practical things you could do literally like today. Then let's say your urgent care centers, what should you do? Then if you're a healthcare system, what should you do? And let's say you have a whole nation, what should you do, including some of the solution in airports and so on. So And then, by the way, then after I give the overview, then I'll bring my colleague Nina into the line. Then she'll show us some live demos you could just see. Again, by the way, feel free to ask us questions and so on. So the first one is, if you're an individual doctor and therapist, the good news is we actually have a free VSee clinic. Again, it's fully HIPAA compliant. Just go to vsee.com, download that. You could get it operational right now. Again, so now you actually have the offering to offer to your patient. And one of the questions we get asked, how is this different from, why can't I just use something like a Zoom or WebEx or all those things? Isn't it just video conference? So one of the key thing about the free VSee clinic is it has a queuing capability. So what it allows you to do is, for example, let's say you're talking and having a virtual session with a patient, and then the patient came in, maybe another question came in a little bit earlier or a little bit late. So you can actually do text chat with someone while you're handling the session. Again, all these patients will be put in the queue. You can even put patient taking the out of order. The reason this is very critical is when you have something during these for massive flu, a coronavirus, right? You have this where you have to quickly triage and handle patient in different order based on the severity. Again, this is one of the key components that make actually the free VSee clinic a lot more useful than just a normal video conference. Then we also do have a set of these number of paid features for adding branding, and also you can actually put a calendar to allow the patient to self-schedule. And you can also easily turn on credit card payments, or even things like insurance verification, and we're even having the VSee system submit the claims on your behalf. Again, the idea is just handle all the technology logistics for you. Now, again, this is for individual physician. Now I say, okay, what about next? Supposedly now, let me scale up a little bit. Supposedly now you're urgent care center, or maybe a network urgent care center. So one of the things you could do is you could actually stand up a telemedicine nurse or doctor hotline using chat or video. Again, later on when I bring Nina, I will show you a live demo how that look like. Again, this is meant to be, you can stand this up very fast and typically within 24 hours. And one of the key things how you will stand up these for nurse line is you probably will expect is when you first stand this up, you actually usage a patient load will be might be modest because even you have it, but patient doesn't know about this yet. So again, you could just start with a single nurse or physician just manning this line. And then as your patient volume increases, so VSee has a built-in Uber-style load balancing system. That means as patient volumes are coming more and more, then you can distribute the incoming patient into a pool of provider. It's meant to be very elastic. I mean, you could just as patient increase on you when you are coming into your telehealth system now, then you're just adding more provider. Again, these providers, they do not need to sit in things like a call center like environment. They can even work from home, be fully distributed. And then one of the some best practice is one of the things what VSee allowed to do is we can import all your patient into our system. Then we create a set of templates and you allow you to do mass SMS as your email to all your patients to let them know that you have this service. And one of the reasons I mentioned this as a best practice, so we've been doing urgent care work for many, many years in there. We will look at the successful urgent care versus maybe less successful. You actually come down to marketing. I mean, just because you have this, your default assumption should be people don't know about it. So you actually have to, if you don't do the marketing, get this out there, people have a hard time discovering this. So again, one of the things, just using this mass outreach to your patient, just give them know that this is available. Then we also recommend you can have this very simple link on your website landing page. Another good practice is just in your email signature, just add that link. So the idea you just want to spread your link everywhere, make it very easy for a patient to come in from different perspectives. Another really big thing is with the coronavirus coming out, what that created is you can see all sort of interesting business. They will use this to write out as a way to grab market shares. So if you're not out there putting your Facebook, Google ad, putting out there, that someone else will come in. That's essentially is they're using this event as a way to steal your patients. So you actually have to have some strategy out there So one of the things we recommend is, by the way, you can do this a very simple Facebook ad. Then from there, you can click on the link, drop onto your web page, and start a HIPAA chat from your front desk. Again, this will allow you to have this sort of patient acquisition funnel to this. And that tends to work very, very well. So now let me scale up one more layer bigger. Now, so suppose your entire healthcare system in there, right? This is not just urgent care. So our recommendation is you should take all the advice you give out for the urgent care, all the advice I give out for individual providers, and put them together to deploy everyone. Again, one of the reasons for this is you might thinking, okay, well, if I'm not a physician, I'm not actually going to be serving the coronavirus patients. Why would I need to worry about telemedicine? Now, the reason is your patients are very scared to actually come physically see you. Right? They're very nervous. They're very worried about the patients say, I don't have the virus, but I don't know if I come into a waiting room, I don't know who else I just sat on that chair. You create a lot of these, like nervous. In this case, I mean, even if you have nothing to do it, just offer the service to your patient. So that I think a patient will really appreciate that. Then the next thing we recommend is you should actually also use the VSee Messenger to actually use to set up a remote patient exam. The reason for this is we're working with a couple of very large healthcare systems in the US and look at their planning. Is if you look at the rate of the growth, right, it look like because each patient, they tend to spread out to about 2 to 3 other people. So if you look at the exponential rate, so I mean, by the probably like April, May timeframe, you could have just huge spread out, like literally talking like millions of people in America will have this. That means if your healthcare system, you should plan a huge portion of your physicians and nurses, they actually will have the virus. Then they will need to be home quarantine at home. I mean, that now how could they work in this? So one of the model is that the patient could still physically come to the hospital, then they could do it using the remote patient monitor, remote exam in this, then they could still work from home in this. The another thing we highly recommend is actually using the remote, the VSee clinic to do remote patient monitoring. You can easily hook up things like body trace, digital scale, whether blood pressure cuff, like Dexcom, continuous glucose monitoring. There's a bunch of pulse ox, there's a bunch of those things. And as you stream the data into your system, this will allow you to get this idea. You can sort of decrease your hospital's in-person patient load. Again, the rule of thumb, the goal is you want to able to take about 50% of your current load and able to remove them quickly onto virtual. And this will allow you to have capacity for the people who actually need to be hospitalized in ICUs and so on. Now, one of the new things, as you start doing the remote patient monitoring, you could actually naturally essentially use the same infrastructure to do a home quarantine solution, because you should expect as a hospital, your hospital bed will run out, right? I think right now, I was reading some projection is, right now it looked like as if based on current growth curve, by sometimes in April in there, that means your hospital will be full. But the trend will continue to ramp up in the May, continue to expand. That means you're going to have a lot of patients, you have nowhere to send them. Then in this case, you want to able to really put the patient that's very sick in your hospital, of course, but the people who actually does not need the hospital, you actually need to push them back into their home in this, but you still need to take care of them. So one of the things we recommend is something like a Med1. This again, by the way, there's a bunch of those like devices out there. The one reason we like this is one device, everything included from thermometer to digital stethoscope, it's just out there, like just simple. And one another thing that we really like about this device, it uses a USB connector. You're going to see company out there, like they have these sort of like Bluetooth, all these things. Yes, you can make it work. But one of our experience, right? If you have a company that show you some, some simple device, Bluetooth guitar, it looks great on paper. It looks great on a demo. If you actually go deploy this in quarantine environment in this, you can have enough time so the Bluetooth pairing it takes like 60 seconds. Your patient's going to be frustrated. Your provider's going to be frustrated. And we recommend in this case, right, USB cable connect, it just works. You don't need to worry about this. And another thing we recommend for home quarantine, okay, there's a number of companies that have this sort of, again, digital patch you put on it gives you continual temperature measurement. Again, you can take those, stream out into the VSee dashboard. This will allow you to, again, you can monitor a number of patients at home. So let me then focus on the healthcare system a little bit more. As I was mentioning is, your hospital will very likely have run out of capacity for quarantine room. Again, if all these sort of projection is about happens basically sometime in April timeframe, you'll be run out, and then during the May when the patients still can, you literally have no space in there. So in this case, and within the hospital itself, is to create these sort of true quarantine room, again, really require a lot of logistic in there. So the idea, how can you create this using digital quarantine room to simplify the logistic of medical staff moving between the rooms in there. So by the way, some of these things I share with you, we actually initially did this during the Ebola crisis a couple of years ago in Africa. And the whole idea is, right, you could use in the patient's room, you could have an HD handheld zoom camera, you could have a video capture device, so pull so for example, this is showing it's a simple device. You can pull in whatever the vital sign monitoring in the room into a small form factor PC or laptop. Then you sort of stream this out. The nice thing about that is that you could have using the VSee Command Center, which is a list of these sort of like a quarantine room you're monitoring. Then you could just click on any one of them. Not only could see the video, you could control the camera, but you could also stream the live vital signs, see that at the same time on this. And one of the things that's very interesting is we actually also have what we call VSee TV solution, and we're pretty excited about this. So the idea is like, like during the quarantine it's a little bit boring, right? The patient is sitting there, there's really not much to watch TV, maybe playing a phone in there. So the idea is there's a simple device, you just connect the essentially for your HDMI cable, you just put this device in through that cable in there. What this will allow you to do is do a semi-transparent overlay on the top or bottom, in fact, anywhere on the TV. You could do things like medication reminders. You could do things like patient instructions. Right? And the nice thing about this system is like you can still watch the TV, just a gentle reminder. So we think it's a very gentle way to able to, again, to keep track of the patients, to make it a little engaging. And then the final thing we recommend for healthcare system is actually deploy the VSee Messenger for provider-provider coordination to fight chaos. Now, what I mean by chaos is, so when we started the VSee, that's going back to more than 10 years ago. So me and my co-founder Erica, to be honest, we had no idea what we were doing. Then we actually met a number of the U.S. Department of Defense. They were using our software to do these sort of disaster relief. Then eventually I was fortunate to be asked to join the Strong Angel, one of the big disaster relief exercise. I was one of the board to direct the whole exercise. It was an exercise we held in San Diego. We had more than 800 people participating. This is like Department of Defense, Navy, the local fire and police, healthcare system, just like this. So when you have those type of environment, you should assume chaos in there. Just like, for example, if you watch what some of the hospitals like in China, in the early days, it's just chaos because your hospital is not used to handle that type of volume in there, right? And now all of a sudden, the things that never broke before will break. Again, now when you have that type of chaos, now what can you do in this, right? So now you need a very lightweight to able to, simple to able to do a very complex and quick coordination in this. And you need this tool to be able to do really, really fast. The problem with email is just too slow, right? If you expect to write someone email, get an answer back, you are putting patients' safety in severe danger in the right. But at the same time, a lot of these sort of collaboration tools become something too complex. So what we see is interesting is we have the concept you could do a broadcast chat. I mean, you could get your entire healthcare system, all the hospital staff, multiple locations into a single group. Then this allows you to do these sort of broadcast message to everyone there. Then you go to create these sort of chat group for different, let's say, cardiology department, urgent care, pediatrician, and so on. Then you could also use this. Typically, how you work, you just type someone's name, you autocomplete. You could do this sort of curbside console very quickly. And the one thing that we see interesting is we allow you to do lossless screen sharing. This is not unlike something like a typical web conferencing tool for general video conferencing. What they do is they will filter out the high frequency components. And if you were to share these or packs, X-ray, MRI, you actually putting your patient safety in danger using those tools. Okay, in the case of VSee, we're allowed to do lossless screen share, just pull out packs. Often the other physician, they might have access to your pack. It doesn't matter, you just use VSee, show with that VSee guarantee is pixel by pixel identical. Now, as also mentioned, the VSee also allow you to do this quick patient exam. You can actually have point a specialist or other physician able to help manage a patient in the location. Now, let me now scale up even further in there. Like, what about a whole nation in this? And so I'm actually pretty honored to be actually be asked by the Qatar ministry to help them do some work here. In fact, I'm in Doha right now. I'm in the hotel there. So in this case, for example, if you think about at the nation scale, like how do you actually manage this? So first, when at the Ministry of Health, at the president level, you have to focus on mass education, right? There's going to be a lot of fake news, a lot of confusion about this thing in there. You have to be able to do mass education. By the way, what's interesting about some of the things I'll share with you, that also apply to a large hospital system because you guys will be so big, right? You could essentially follow the same thing for your healthcare system as well. So one is a mass education. The next one is a mass screening. You want to able to know, for example, let's say have millions of patients in there, like just able to screen them very efficiently in this. Then also create these hotlines in there. And then the typical way you can support this is when it is a massive SMS, right? You could push them out. Should deploy AI chatbot. Those are very easy to script out these or ask these questions in there. Then another thing we really highly recommend is you must also have an interactive voice response system or IVR system. These are for people who do not have a smartphone. So you can, again, so generate these mass calls, press one if you have a fever or various things in this. Then the idea you take all these stream in there. The reason you have to do everything in there is if you look at the entire population level, right? You have your people who's very SMS savvy, but you also have people who don't have a smartphone. And you also have people who feel very comfortable with these AI chatbot-like interface in there. But you just want to be able to do everything. The key thing is you must do everything in a single channel, able to direct them, drop into these virtual visit flow. Because what these things will do while doing the education, while doing the screening, then they can actually drop them into a virtual console seamlessly as required. Then one of the things, by the way, so a lot of the hospitals, they have done these things like, for example, these are SMS to do a calendar appointment reminders and various things. But in those cases, whatever you pick, you should make sure the system should allow two-way. I mean, for example, when you do this mass SMS in one way, then if I get this, let's say through the government, or I come in for my hospital, I should be able to text it back in this. That text back should able, again, flow back into your hotline in this. The reason this become a very efficient way to both reach, but unfortunately, most of the EMRs and practice management system that's currently deployed, they only do one way, which is a huge loss in there. And by the way, another very best practice in there is when you do the SMS back and forth, is not HIPAA compliant. So just because in the emergency in there, you should still follow these best guidelines. So one of the things you could do is you can actually send a person SMS that include what we call deep linking. The deep link is supported by all the mobile phones. That will allow them to click on the link in SMS. take in the app store, let's say download your government's or your hospital's branded mobile app if necessary. But if you have it, you would just get onto the console. But if you actually download them again, you're getting the account to continue on there. So again, this from the experience perspective, is a very simple experience for the patient. Then another one of the key driver for how to think at the entire nation level is you must decrease your in-person hospital usage. The target is about 50%. The reason you're going to have such an increase in load from the coronavirus, you must take everything you're doing now, able to suppress the usage, just so you can sort of build the capacity in there. And one of the reasons this is really critical is you probably saw the studies from China that for the patient who got the virus at the January versus the patient who got the virus in February in Wuhan, China, right, the epicenter in there, the death rate was huge difference in there. And I think how could be have such a big difference? Well, when they have onset in there, they just literally have patient lying in the hallway, they just couldn't handle this. Then by the time you get the second month, and then they were able to build up so much capacity in terms of the hospital, into the capacity. Now they can actually decrease the death significantly. So this is one of the things you must gear up to expect you go hospital will run out of capacity. Now you must put a set of procedure in place now so you can sort of get ready for that. So some simple things in many countries, in order for the employee to have a sick leave, they must go to the doctor write the note in the right. There's no reason that the patient need to come to your hospital. Then the government should just make a mandate for work leave, those things you must do by telemedicine. Just you can move these off your in-person. Another thing is the medication refill, right? There's really no reason that would need the patient to come in, right? Make a mandate, move these off. In fact, if you should take, typically in the most countries, if you should take these two items off, there's a mandate of them, you can see a huge significant drop on your in-person visit already. Then we add in remote patient monitoring, then you can take a lot of these cardiovascular things. Now you're shooting keeping the patient at home now. Now, one of the things that VSee is interesting, we actually have this off-the-shelf VSee clinic app. You could actually take that, just drop into your ministry's app very easily. And this will allow you to have your own branded mobile app, again, all within your government containers. And then the last thing we recommend is have virtual medical staffing. So what I mean by this is because of chaos this will happen, you will have shortage of staffing here and there. To the extent you can sort of virtualize your staff, able to move staffs using telemedicine and coverage that back and forth, that should be very, very useful in there. Another one thing we recommend is create these sort of asynchronous access to specialists. So typically what you could do is you could have, let's say, as we use your primary care example, you could just submit these cases. So for example, you need account requests, here's a patient's case for a cardiovascular, like diabetes, you just submitted this, a pool of specialists. Again, these are asynchronous in there. Then this allows the specialist log in, just see a bunch of these requests, they review the notes, write some notes, and this will be shipped back to the primary care physician. Again, this is a very efficient way to sprinkle expertise to all the places that needs to go there. And then, of course, you can elevate to a video as necessary. And sorry, let me just finish that. Okay, sorry for the sharing. Okay, sorry about that. The PowerPoint made my sharing go off a little bit. So this is an actual example of a nation scale response. So again, as you focus on the awareness, then you have typically have
hey, Milton, Milton, are you sharing a PowerPoint slide?
Yeah, isn't that
we
showing?
Don't see it. Yeah. You were sharing it before, the one for nation.
How about now? Do you see it?
Yeah, thanks.
Oh, great. Okay. Great. Okay. Thanks for that. Okay. Again, so this is an actual example at a nationwide scale deployment. So the idea, typically you have many government properties in this. You want all these properties just again spread out, do these sort of entry point, touch point, just able to everywhere. So that you want to able to embed these, from, just drop your AI chatbot into everything in there. You actually linking with your IVR, these are hotlines that connect them into these are central database. Then again, things like these were, by the way, so in this example, we're using the Cerner as a EMR. So again, you can even pull these with a high risk patient and stuff. Then you can actually do proactively outreach to them, able to call them, monitor and screen them properly. And then you can use this again to push this information back into Cerner. And also from this, you could drop into virtual visit and so on. Again, the whole idea is you want to able to taking all these pieces together, make sure they actually work seamlessly from one piece to another. Then you have this end to end. Again, another key thing is you have to make sure this can scale to millions and millions of people very rapidly. And again, so what's interesting as we work on this project, look at some of these, I was really surprised at how fast you can stand up some of these with a modern architecture. You can actually, for example, call millions of people, within a few days type of thing, like create this massive call center like infrastructure, but fully distributed. And then the final thing I'll share with you is, is about airports in this. So perhaps as you see the news we flew recently, right? The bad news is like it's about 50% of the coronavirus patients do not have fever in this. Now you're thinking like, why is all these airports putting on the thermal cameras and all these different things? In fact, often this can even backfire. You probably see that in certain countries, if you talk about, because they have this sort of thermal camera, they actually create a huge backlog. You have all these patients, all the other passengers congested in a very small environment, a huge crowd of people. It's almost like if you want to create an environment that spread virus, like put a thermal camera in there, create a backlog. This is the thing. It's just like, to me, it's like a little bit, it's probably not the most ideal case for them. Then you have to also have a country like things like Israel, right? They just say, okay, anyone who come in the country, 100%, 14 days or longer quarantine, right? Just everyone in there. Okay, I think that one seems like, okay, it would definitely work, right? Making sure that it doesn't get in the country in there. Of course, that one is fairly disruptive in this. So we're thinking, okay, could we have something that's actually a little bit alternative, something different? It's not this sort of thermal camera, which that's, based on the coronavirus infection rate, it really doesn't do anything in there. So then the idea is you actually could get these COVID-19 rapid tests. Typically, these tests come in two different flavors. One is this blood-based test, a single, small pin blood, just like your glucose monitoring there. Then typically within 15 minutes, you could check based on the antibodies. You could actually figure out the person has virus or not. And then there's a 6-hour RNA, then they come into DNA tests in this. You might think, why do you have these two tests? Because if someone has had the infection, but their body was to fight out, they will still have the antibodies, but they don't have the virus in there. So the idea, you want to do a screening of everyone using the quick 15 minutes in there. And then if they actually fail this test, you can use the 6-hour to see, just in case they actually have the immunity. So the program we're actually creating, we actually, just like in the US, you have the TSA pre, right? You could go through the airport fast. So we call this, our system called the CVC pre, okay, COVID clear. So the idea is, right, you're using mobile app, continuous tracking with GPS on, and then you actually only allow a passenger to board to be able to come into your country, into, let's say, all the different, like a flight that will come into a country, and you actually check on this. And if they're pass, then they're allowed to come in the country. We think using this combo of mobile plus this sort of checking, this actually will allow you to actually control the spreading across with the so allow the airport to function in this. Again, a lot of times these tests is a picture. There's a rapid test, very simple in there, right? You can actually do tons and tons of these tests very rapidly in this. And then the fine-tune slide is so the I hope this maybe not doesn't come as maybe too negative in this, right? So over the past 10 years, so we work with, literally like thousands of different type of, from healthcare system or practice in there. So we find there's a type of people we call just, they sort of don't get it, right? So these are people just say, oh, I got my doctors in my healthcare system video conference. I'm done, right? There's nothing else I need to do. Or my EMR has video this already. I'm done. It's like literally, I'm done. I don't want to do anything else. It's very important if there are people like that in your organization. They could be very nice people. You must move them out of the decision. You must neutralize them because they will be a barrier. Because medical workflow is about efficiency, it's about triage, it's about load balance, it's about medical exam, it's about switching asynchronous. All these are beyond just video. If you just have video, you will fail. Because imagine that the chaos environment when your doctor is so tired, all these things, you can't do this in there, right? That's why you must have a system where have the people in your organization support this. And then the final thing is I just said, who are some of the people who really gets it in there, right? So I just want to name, like, if you want to talk to people who actually really understand this, who actually have the right thinking, who I think they will just, they will fly, by the virus settle down, I think you're going to find a lot of hospitals, they will essentially have failed because literally the IT will just slowing them down. Then you're going to see a lot of these hospitals, they actually just like down with flying color. Again, these are some of the people we actually really enjoy working with. They're like, that's how they would think. I think just like amazing. And then there's a specific person who I learned a lot about these master system, the ranger in there again. So you can go to his website. So if you want to think about how do you figure out at the country level, rapid deployment, about how do you deploy entire country with millions of people within 7 days, right? Deploying everything in there. You got to talk to him in this. Then we also would love to thank, for the past couple of weeks, we worked with a bunch of partners for a bunch of initiatives from Cerner, Advantech, Microsoft G, Med1, Logitech, ManRay, Body Trace, and so on. And again, we have a bunch of other partners. I apologize if I forgot mentioning in this. Again, but the slides are freely available in there. And how about I'll pull in my colleague Nina in, so she will share some live workflows. You can see how that actually work in practice. Nina, do you want to? Okay. Hi, Nina.
Hi, Milton. Hi, everyone. So I'll go ahead and share with you our different solutions and how you can deploy it rapidly. I'm trying to check if I am sharing. Does everyone see my screen? Okay. Can you see it, Milton? All right.
Yeah, I can see it. Sorry, I muted my mic. Yes.
Okay. All right. So as Milton mentioned, there are different ways for you to start setting up your virtual visit clinic. And one of which is the free VSee clinic. So if you want to set up real quick, all of this actually you can set up in a matter of minutes. Just yesterday, we had one of our partners actually requested to set up 41 VSee clinics in like 2 hours. And it's fairly easy to set up, and we were able to deliver that. So what I'm showing you right now is what the free VSee clinic looks like. So you can set it up, go to our website, create your free VSee clinic, and as I mentioned, it can be done like 5 to 10 minutes. It's pretty simple and straightforward. It's mainly a walk-in waiting room, and the part here, the description of your clinic can be edited, so you can customize that. And then you can just immediately share this with your patients. So a lot of our clients use just the waiting room functionality, especially if you have your existing EMR where you do most of your scheduling, billing, and everything else. Then you can continue to use that and then direct your patients to go to your virtual clinic for the visit. So we do have a mobile app, so they can download the VSee Clinic app, and then they just need to enter the room code that you give them, and they'll be able to access your waiting room. And also, we recently launched an in-browser option, so they'll be able, the patients who are on, say, their laptops or computers, they can log in. They don't need to download any app, and then their video will just launch, and then they'll be able to see the provider. So how does that look like for the patient side? It's pretty simple, as I mentioned, and straightforward. Patient just clicks on enter waiting room. And then they don't even need to sign up. It's up to them if they want to sign up with an email, or they can just proceed as guest. And then they just fill in their name. So this is a standard intake form. We can customize it as well, depending on your requirements. And then, as you can see here, there's a link to the consent for the telemedicine consultation. So we do have a standard consent form, but it's also up to you if you want to customize that. We can do that as well. And then once you hit continue, the patient's video screen will launch, and they'll be able to wait, and they will wait for the provider to start the visit. Okay, so that's just the most basic VSee clinic, the free VSee clinic. Now I want to show you, yeah, Milton?
The nice thing about that one is what Nina just showed you is actually our free product. You can start using it immediately today, then offer to your patient. It will be always free and just.
Correct. Yeah, so this, what I'm showing you right now is the standard VSee clinic. This allows you to, as you can see, you can brand it with a logo. This unique URL, you can link it to the website. So when your patients go to the website, they click on that link and they will be brought to your virtual clinic page. And as you can see here, aside from the walk-in option, they now have the option to book an appointment. Again, these features you can turn on and off depending on the requirements. Now, this setup is what a lot of our partners are doing, because their setup is they have a lot of providers who are available whenever a patient walks in. Whoever among the providers can initiate the call. So I'll enter now as a patient. So you can see how it looks like when I enter as a patient, and then the provider launches the video call. Okay, so this is our light EMR, so patients can update their medical information. Again, these features we can turn on and off. If you have an existing EMR, EHR you're working with, then you won't need to use this. Okay, so as you can see, my GoToWebinar is just using my camera, so VSee can't launch it, but basically this is how it would look like on my end as a patient. And then as you can see also here, hold on, I have so many windows open. Okay. Right, so there you see the provider has initiated the call. As Milton mentioned as well, you can do screen share, so you can show that real quick. Okay, so we can do screen share and annotation. Maybe discuss, during the consultation, the provider can show any image or any file or any application to assist with the visit. All right. Then after the consultation, my provider can just end the call. Okay, and then we do have a standard post-visit survey where I can basically, give my feedback. And then if I want to receive like a summary of the visit patient instructions from my provider, I can type in my email and I will receive the visit notes. Okay, so that's the patient side. Now I want to go ahead and show you how it looks like for the provider's end. Okay, so for this particular clinic, as I mentioned, this is the setup that many of our partners use right now for their COVID-19 solution. So they have 10 to 20 providers in one clinic, similar to this one. And then all of them can log into one waiting room dashboard. So right now I'll log in as a provider. And this is what the provider's dashboard would look like. So you would see like all the patients waiting in the waiting room. And then, so this dashboard will be seen by all the providers who log in. And in case, one of the providers start the visit with the first patient in the queue, it will already be under the in progress column so that the other providers would know which patient to reach out to next. Now, like a lot, as I mentioned, some of our partners who are using this solution, they utilize what we call the CSR workflow, or the customer service representative. Basically, we also give their staff, their front desk, or maybe their nurse, access to this waiting room, and it just allows them to first engage with the patient, maybe do the initial screening, fill up a form. For some, they just use it for just checking the audio and the video. And then once that's done, they can return the patient in the queue and tag them as ready for the physician. So on the physician side, they will be able to see that tag and they can start the call with the patient. So I want to show you how it looks like when I start the call with a patient. Okay, so this just basically allows me, this is where I can take notes. Again, you can opt to just use your existing HR. The VSee video is separate from any browser or webpage, so they can, you can actually open up your existing HR and type your notes in there directly. You can also chat with the patient. And then to start the call, just click on the camera icon.
Are you guys seeing some of these cameras? Because right now we're doing using the GoToWebinars, it's on Confluent, but if you're not doing this, so you'll be actually much faster to launch as well.
Okay, so there you go. So now I see the patient, Kristen. By the way, whenever a patient walks into the waiting room, you will receive a notification on your VSee app that a patient is waiting. You get an alert sound as well as a notification via SMS. And then I do have the option again, if you want, if you're a CSR and you want to pass the patient or return the patient in the waiting room, you have ready for you can keep them in the waiting room, or you can proceed to check out the patient.
Yeah, the concept of CSR, or customer service reps, is something we strongly recommend, especially if you're in a bigger practice in this, because that will essentially show your doctor and nurse to allow them to be more efficient. Nina, I think we're wrapping up in about 4 minutes. Maybe you could quickly show the remote patient monitoring.
Sure. Okay. So this is what the remote patient monitoring dashboard looks like for the provider side. Similar to, or basically what Milton mentioned, the patients can have these devices at home, and they can just use it as they usually do, but it is automatically, or we can configure it to link to the VP Clinic dashboard, and it will allow the providers to see in real time, like the device data uploaded to your dashboard, so you can review. It can also be arranged in different alert levels, so you would know like which patients need to attend to sooner. So this is just an example of how the dashboard would look like for you, and the different devices that can be used right now.
Yeah, and we have different layout, things like compact layout, different ways. So this will allow you to, in the case of maybe monitoring versus like you want to drill deep on a smaller population versus bigger. So there are different layouts that allow you to be very efficient to be able to handle these cases. Okay, one thing is, I know we're coming down to the end of the hour. I apologize, we have a lot of content here, because normally we actually do have a lot of have time for questions and answer your questions in there. I know to be respectful of people's time in there. How about for the attendant, please definitely email us your questions in there. So my email address is milton@vsee.com. And are hosting this. What we will do is, so we got quite a bit of people's emailing outside of this. So next week we will do another follow-up to this session. In that case, all we do is just we answer everybody's question. We're just going down there. We're going to sort them beforehand based on different categories of interest. Then of course, all the answers we'll also publish them, write them as well. So I would say, please definitely send me your questions. And again, I apologize. We should have done do a longer session here question, but I think it would be more effective. Again, we do that right away. So this will make sure all your questions we get to answer them. And I guess, Anne, is there any other announcements?
No, just we have another webinar coming up next week. It's already, the link is in the chat. So if you have questions about malpractice and telemedicine risk and safety, we have a guest speaker from the doctors, their malpractice group, and it should be a really good session. So you can get a lot of questions answered there. So I recommend that you guys sign up for that. Yeah,
terrific. And also another thing is we're in the process of synthesizing a bunch of these or large-scale solution there. So if you have some building block, maybe some sensor or some other thing that I think could be fit into at the country level deployment, definitely reach out to us in there. Then there's a good chance we can actually include some of those building blocks in some ways a big rollout we're doing. Again, thank you so much for everyone tuning in this session. I know you guys are really, really busy. I really appreciate time to tune in. Please email us or send us some questions. then we're going to do a follow-up to just, again, answer everyone's questions. Again, thank you so much for joining us.